Hi everyone, so my name is Franz, and I'm a clinical social worker here at the Memory and Aging Center. I'm so glad to be here today to talk about the subject of caregiving. I have worked with many caregivers throughout my time in social work. They have been daughters, sons, siblings, cousins, neighbors, partners, spouses, friends, and more. And I'm glad to have the time to talk more about them, a little bit of what they face, what you all face in this room, and how we can possibly best support. So what is a caregiver? I know we have many caregivers in the room today. I think sometimes we most often think of caregivers as professional hired caregivers, when in reality most caregivers are actually considered informal caregivers and come from the community around a person. So this definition is from the Family Caregiver Alliance. A family caregiver is any relative, partner, friend, or neighbor who has a significant personal relationship with and provides a broad range of assistance for an older person or an adult with a chronic or disabling condition. And a side note is that the Family Caregiver Alliance is a wonderful organization, and I'll touch a little more on their organization later on. So I truly believe that caregivers are the real experts in dementia care. I am continuously humbled by the creative, resilient, and loving lessons I am taught through working with caregivers and through people who are experiencing cognitive changes. I call these caregiving gems of wisdom, and I'd love to share some brief ones now. The names have been changed. So my first one is I worked with a caregiver, Bill, whose dear friend, Rick, moved to a memory care facility. Like any of us, Rick would have good days and bad days. Bill learned that arriving with milkshakes always started the visit off on the right foot. So gem number 1 is arrive with milkshakes. Number 2, I worked with a family who was made up of many different caregivers. Some lived near, some lived far, and all supported their father in different ways. Marvin was in charge of finances, Tanya was local for driving to doctor's appointments, Tom would visit for extended periods of time. Each month, they all had a scheduled meeting to get together on Zoom. They chatted and laughed with their dad, sometimes for a while, sometimes for a brief moment, and they all got together to review upcoming caregiving tasks. So I just thought this was lovely. So gem number 2, different family members can thrive in different roles, and meeting regularly can be really beautiful. Gem number 3, this lesson I learned from someone who's experiencing memory loss, Kim, who created a daily calendar system. So each day she would reference her calendar and write down a daily schedule for herself that she could reference whenever needed. Her husband, Alex, supported this system, keeping her updated on appointments and ideas for activities, whether this was an exercise class, a phone call from a friend, or even just a scheduled day set aside for rest and relaxation. So gem number 3, big or small, get it scheduled. Number 4, this is our second milkshake, you may notice. I worked with Laura, who was a caregiver for her mother, and she wanted to make sure to take her out of the house regularly, though mobility was a challenge. They started a routine of going on weekly drives to look at the fall leaves, winter holiday lights, spring gardens, and in the summer, go to the drive-thru for a milkshake. So gem number 4, drive to the milkshake. For number 5, I worked with Jane, whose father, Xavier, loved Christmas. His favorite time of year was when a Christmas tree was in the corner of his living room. As his dementia progressed, Jane decided a permanent Christmas tree would reside in his room, despite the season. So gem number 5, every day can be Christmas. My last one, I heard this one recently and it has really stuck with me. Vivian noted that every day she would create lovely meals for her mother, Vanessa. She always made sure Vanessa's food was nutritious and displayed on the plate nicely. Meanwhile, Vivian would stand upright in the kitchen and eat what was left in the pan. Vivian realized she needed to take care of herself with the same love that she cared for her mother. From that realization on, she vowed to create 2 beautiful plates and give herself the same time to sit and eat her food. So gem number 6, caregivers need care. This brings me to speak about the side of caregiving that folks may be less likely to speak about, the hard emotions that often exist amongst love and honor and service and joy. Guilt, anger, exhaustion, overwhelm, frustration, isolation, confusion, resentment, anxiety, apathy, fear, and grief. I hear some or all of these emotions from nearly every caregiver I've ever worked with, and yet most caregivers are surprised to hear that they aren't the only ones experiencing them. I've learned that many caregivers are truly experiencing grief, as well as the people with memory loss, without always having the right words to name it. So I've learned two terms that have really stuck with me: anticipatory grief. So this is grief that can come from anticipating a loss, often from thinking about the future and what may be coming, what may or may not happen. The second is ambiguous loss. This is a term coined by Pauline Voss, therapist. This is a loss that includes both presence and absence, where someone may be with us, but life looks much different than it once was. This quote from Pauline Voss I really like. It says, "I intentionally hold the opposing ideas of absence and presence because I have learned that most relationships are indeed both." So how do we support our wonderful caregivers and people with memory loss? How do we help them hold the good and the bad and the confusing? I think there's many ways, but I'll highlight three: community, support, and respite. So community, this is just the idea that we all need each other. It's a relief often to be in the presence of others going through similar experiences, to be around people who get it. Get it is a term that I hear a lot. So for caregivers, this often means connecting with other caregivers. For people with memory loss, this often means connecting with other people who are experiencing cognitive changes. There's a couple ways. So support groups are wonderful. I'll get into how to access those in a little bit. Caregivers connecting online. I found there's some beautiful online communities. And there's also a lot of really amazing social media accounts of people sharing their experiences. And memory cafes, so these are meetups where the person with memory loss and the caregiver, care partner attend together and get to meet other people. And there's also just local meetup groups in general in different communities. Support, I think this really means reaching out to others to create a team. This can look like counseling. I've spoken to many caregivers who have really benefited from working with a counselor to help navigate challenges and put words to their experience, as well as people with memory loss. Navigation programs and classes. And connecting with a medical team regularly, whether that be your own medical team for your own wellness, and the person that you're caring for team as well. For respite, I believe there's a deep need for respite and rest, and that this can come in many forms. The first one being planned visits from friends, family, neighbors, and other community. I say planned because I've learned that being able to count on respite is deeply important. So to all those who are not caregivers, we can think about reaching out and offering respite to those who are. This can look like being intentional about spending time with the person they care for, taking them out for a hike, a meal, a weekly manicure, so that the caregiver has some time for themselves. This can also look like hiring private caregivers, as well as adult day health centers. Of which there are often one in each county, not always, but I'll touch on how to find them. So now I'd like to review a few resources, possible starting places to find this community and this respite and this support that is so needed. So GUIDE is a new Medicare program. So if someone has a dementia diagnosis and also has traditional Medicare, so that's A and B, not Advantage, the GUIDE model is free and offers monthly dementia care navigation calls, caregiver support, and up to $2,500 in annual respite. There are different ways to access guides. There's different organizations providing it. In San Francisco, this is through UCSF Care at Home, as well as San Francisco Health Network primary care patients are served by UCSF. There's also 3 different organizations that provide it to San Francisco and the wider Bay Area and Northern California. Tembo Health, Senior Doc, Hodo Care. And then there are additional options. If working with John Muir, you can ask about enrolling with Guide. And Medicare's Guide website also has a list of all the sites participating across the country, so this isn't just California. Another option is resource centers. I love resource centers. They are in every area of California, and they can provide many free services. These services can include 6 free caregiving counseling sessions, support groups, legal consults, tailored resources, and family consultations. The resource center specific to Bay Area counties is actually Family Caregiver Alliance. They're wonderful, and that's the organization I mentioned earlier. The Alzheimer's Association has a 24/7 helpline. This is often the first thing I give people. What I love about this helpline is that you can call to ask just small questions, to brainstorm a solution with someone, or to get guidance during a crisis, or if it's just 3 a.m. and you need someone to talk to, they are always there. You can also find resources online through the Alzheimer's Association, communityresourcefinder.org. You just put in your zip code and they'll pull up all the different events and support opportunities in your area. So this could be support groups, this could be day centers and more. You can also just call the helpline if you prefer that to find resources that match what you need. You can just call them instead of going through the online system. So to our caregivers, our participants in our communities, so much is possible because of the time and the caregiving wisdom that you give us. So I'm so grateful and honored to work with you, and thank you so much.